Welcome to the first in a series of health impact assessment videos. I'm offering this introduction as part of my ongoing efforts to perpetuate the standardization practice of HIA, which promotes incorporating health into decisions outside of the health sector. We all know that our health is affected by more than our genetics and our behaviors. Health is also dependent on outside factors such as access to healthy foods, the quality of our housing, and whether we have a job. These factors are called the social determinants of health and are a part of a World Health Organization definition of health that includes not just the absence of disease, but also a state of well-being. As you can see from this slide, the social determinants of health, which is everything except biology and genetics, contributes to 90% of our health outcomes. Health impact assessment is a way to examine a policy, plan, or project and predict its effects on a specific population before the decision is made. HIA is a tool that helps policymakers objectively evaluate the potential health effects of a plan, project, or policy outside the health sector before it is built or implemented. HIAs encompass a variety of methods and tools, have been performed extensively in Europe, Canada, and other countries, bring potential health impacts to the attention of policymakers, particularly when they are not already recognized or are otherwise unexpected. HIA is a systematic process which involves clearly defining the problem, using a robust research design, and developing recommendations that will minimize the negative and enhance positive health impacts. HIA uses health as a framework because it is something everyone can relate to. It creates a common currency for decision criteria and opens the door for a discussion of the connections between health outcomes in a policy area not always connected to health intuitively for most people, such as where to site landfills. On the surface, it is a zoning problem. You need to find a parcel large enough, zoned properly, and preferably far enough away from residents who would find the use unacceptable. If you view it through a health lens, it is about the quality of drinking water downstream from the site, the possibility of diseases that would be passed from animals frequenting the site to humans living nearby, the leaching of heavy metals into the ground where children play. This changes the parameters of the decision to be made and brings in new considerations. All decision makers want to limit exposure to toxins and pollution, especially to those who already have health disparities. One of the most common reasons cited for performing an HIA is to bring to light health inequities and have them be addressed or ameliorated in the decision-making process. What values underpin an HIA? Democracy, for one. The right of people to participate in the formulation of policies that affect their life, both directly and through elected decision makers. This means that the community plays a major role in the HIA process. Equity, the reduction of equity that results from avoidable and unjust differences in health status between different peoples. And HIA assesses the distribution of impacts from a proposed policy or project with a particular reference to how the proposed policy or project will affect vulnerable people in terms of age, gender, ethnic background, and socioeconomic status. Increased awareness of health issues. When public health is brought into the decision through an HIA, it tends to raise awareness of all health-related issues, not just those associated with one project. Scientific and robust practice. Emphasizing the transparent, systematic, and impartial processes are used, which utilizes the best available evidence from different scientific disciplines and methodologies. The National Environmental Policy Act went into effect January 1st, 1970. The purpose of NEPA is to protect the human environment and stimulate the health and welfare of man. The Act establishes national environmental policy and goals for the protection, maintenance, and enhancement of the environment and provides a process for implementing these goals within the federal agencies. The law requires that an environmental impact assessment, or EIA, be performed for federally funded projects that reach a certain threshold. The environmental impact assessment is in, is designed to bring to light all environmental issues associated with the project's implementation, such as the existence of endangered species, impacts on natural resources such as watersheds and pristine habitats. The Act also states that human health concerns should be outlined. Human health, since it is not the primary focus of an EIA, is seldom addressed in this process. In the 1980s, the World Health Organization began to encourage the use of HIA by promoting it in all their projects, creating resources to inform practice, and adopting the Ottawa Charter for Health Promotion in 1986, which endorses the use of health data to build healthy public policy. The practice of HIA became widespread in the United Kingdom in the 1990s following the release of the Exon Report, which systematically analyzed health inequities and made specific recommendations to alleviate them. This report created a conversation in the United Kingdom about inequities and drove the widespread adoption of HIA practice. In 1999, the first American HIA was conducted in San Francisco, examining the impacts of the living wage referendum. In the early 2000s, the World Bank began requiring HIAs on large projects in developing countries, and the first HIA was integrated into an EIA in Alaska in the United States. The practice spread slowly in the United States but grew rapidly in the United Kingdom, Australia, and Thailand. It was only recently in 2011 that the North American practice standards were adopted. That is not to say that practice in the US is not growing. Fueled by the health and built environment movement, in which health and planning professionals work together more routinely, HIA is a way for them to find common goals and seek solutions that improve community health. There has been a growing awareness among health professionals in the United States that they need to affect policies, programs, and plans that influence the social determinants of health. HIA practice is growing exponentially with recent developments encouraging its practice, such as institutionalization in the city of San Francisco and the state of Massachusetts. This is a map for the Health Impact Project, which is a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust that tracks the HIAs performed in the United States. Because it relies on practitioners to self-report, it probably does not capture all of the HIAs that have been performed, but it gives you an idea of where practice is strong and where more work is needed. It is estimated that between 300 and 400 HIAs have been conducted in the US since 1999, but thus far have been few systematic reviews to determine their effectiveness in changing policy. However, evaluation metrics can be applied both during and after the HIA, which is a topic of another video in this series. In summary, HIA is a systematic process used to predict the potential health impacts of a policy, plan, or project. It involves a broad range of stakeholders, including those directly and indirectly affected, and those who would be disproportionately affected. HIA uses evidence-based analytic methods to predict both positive and negative health impacts and uses these predictions to make recommendations to decision makers on how to eliminate or ameliorate the negative impacts and to enhance positive impacts.